TIL stands for tumor infiltrating lymphocytes, and these are the immune cells that our body make to help fight cancer, and it's now approved for patients with metastatic melanoma. So your body is sending these lymphocytes to fight the melanoma, and as these lymphocytes infiltrate the tumor, that's what we call them TIL. When we do that on a patient, we try to collect some of these lymphocytes by resecting a piece of that tumor, and then we expand the lymphocytes outside the patient's body till we get multiple billions of cells. After we achieve that number of cells, that's when we perform the therapy that helps control the disease and hopefully put it in remission. We look at recent scans, we look at prior therapy to be sure a patient is eligible for this kind of tumor. After we establish eligibility, the next step, we would send the patient to a surgeon to resect a piece of their tumor. That piece of the tumor, usually about 3 to 4 centimeters, we do send it for what we call manufacturing. When that happens, we isolate some of these lymphocytes, we call them TILs, and we expand them over several weeks. Now, when these cells are ready, patient will come back to us and we start the actual treatment. The treatment starts with a low dose of chemotherapy. We call it lymphodepleting chemotherapy that goes over 4 days. Once the chemo is done, the patient will receive their lymphocytes the next day, and that's just a blood transfusion. Now, after they get their TILs, we're going to give them a medication called interleukin-2 for 6 doses to help expand these lymphocytes inside the body so we can get more lymphocytes and more active lymphocytes. Now, these TILs are going to attack the tumor, they're going to try to get rid of it and try to put the patient back in remission. Typically, a patient, when they go through the process, they're going to be with us for about 4 to 5 weeks from start to finish. We try to do this outpatient, and we admit them for a few days when they're getting that interleukin-2 for about 3 to 4 days. Once they're fully recovered, they go back to their oncologist, and they follow with us on what we call anniversary visits at 3 months, 6 months, 1 year to be sure tumor is doing okay and they're responding well. At this time, it is approved for metastatic melanoma. There are studies that are going on to go after different kinds of cancers, but the only approval now is for melanoma. So Northside was one of the first centers in the country that got approved to do TILS therapy since it got the FDA approval. We have seen more than 60 to 70 cases of metastatic melanoma for TILS therapy, and we have infused about 15 cases or so. Northside is a very large and experienced cell therapy program, which TILS fall under the cell therapy. So you're going to be taken care of by experienced physicians in transplant and cell therapy with a dedicated unit for these kinds of treatments.